What is going on, everyone? This is Frank the Paramedic, and welcome back to my channel. Um, if you're new, this channel is pretty much all about paramedic medications, EMT medications. We'll be going over all of anatomy, physiology, and any other questions you guys have. Also, be touching a lot on fitness and nutrition. That's always been a passion of mine. But in this video, we're going to be talking about aspirin, ASA, or acetylsalicylic acid. And so this drug can be given by any provider from EMT and up. So let's get into it. So what kind of medication is aspirin? So this is going to be your classes. The main class of aspirin, and the main reason we give it, is for its platelet inhibitor properties. Some other classes, it is mild analgesic. It's antipyretic, which reduces fever, and it's also an NSAID, or non-steroidal anti-inflammatory drug. And again, in the pre-hospital use, we're only interested in its antiplatelet properties. Many people outside of EMS, as well as some people inside of EMS, think that aspirin is a blood thinner, and it's not. It only prevents the platelets from sticking together. It does not thin the blood whatsoever. And how does it work? Mechanism of action. Aspirin works by inhibiting the production of certain prostaglandins, which accounts for most of actions, such as antiplatelets, the antipyretics. Aspirin inhibits platelet aggregation for the life of the platelet, which is about 7 to 10 days. Pharmacokinetics. So that just means, when does the drug work? What's the time frame that the drug starts affecting the body? For aspirin, it's anywhere from 15 to 30 minutes. Usually, it's going to be the latter, that time frame, about 20 to 30 minutes, especially since you're taking this by mouth or PO. Any medication that you give by mouth is going to take longer than IV medications. Simply put, because aspirin, or any medication that you give orally, has to go through the GI tract, whereas IV medications, IO medications, are right in the bloodstream. So the two indications for aspirin is going to be suspected acute coronary syndrome. Pretty much that just means chest pain. We're going to give aspirin for any kind of chest pain as long as it is not contraindicated, which we'll get into this next slide. The contraindications is going to be active GI bleeding or suspected aortic dissection. Now, why is this? Well, if you have any kind of internal bleeding and you give a medication that prevents the platelets from coagulating, you are going to limit the amount that the blood can be stopped. So the platelets need to stick together to stop bleeding. So you get a cut on your finger, right? And those platelets are going to help slow the bleeding and eventually stop the bleeding once all the platelets kind of coagulate and stick together to cover up that wound. So if someone does have a GI bleed and you give them aspirin, those platelets can't stop the bleeding, especially internally, since there's a lot more veins throughout the GI tract. And so that's the biggest contraindication, in my opinion. Suspected aortic dissection, again, you don't want to give it, because if you prevent the platelets from sticking together, you can potentially create a thrombus that moves through the body. Certain protocols also say that the contraindication to aspirin is anyone on anticoagulants, kind of for the same reason. It's just going to potentiate each other. And in some protocols as well, aspirin is not given is not given to children or adolescents with viral infections, because it can cause Ray's syndrome. And Ray's syndrome is just swelling of the brain and the liver. Precautions. There's none in the pre-hospital setting. I don't know if there's many contraindications post EMS care. I am not trained in that aspect, and you guys probably won't be either. So we're just going to stick with this. In most protocols, there's going to be no precautions. Dosage, enter EMT, it's always going to be 324 milligrams by mouth. Most protocols that I've seen, it's going to be anywhere from 162 to 324 milligrams by mouth. Again, it really just depends on your local protocols. And that's going to be it, guys. I hope you like this video. Remember, like and subscribe. We'll be going over some more EMT medications as well as paramedic medications in the future videos. And we'll dive deeper into all of these medications, especially in the pharmacology of all of them in future videos. So